Hello, Dr. Rob here. How are you today? Great Friday going on. I hope you're excited. We've got some breaking news. Great new literature that just came across the wire literally yesterday, really speaking about some of the most common denominators to poor outcomes with COVID-19. And it's an unbelievable one. I saw it. I called all my colleagues when we talked about lifestyle. And this one truly resonates in overall lifestyle. It blows me away. So the answer to the question right away is obesity. Without question, it's one of the most common, if you will, it's one of the most common comorbidities. More so than a common comorbidity, it is the number one reason now they found out from people 65 or less for bad outcomes. So our patient population, our American population, is without question too heavy. I mean, obesity. Now, I will say they did obesity markers with your BMI. They didn't do it with body fat. Now, we happen to do it with body fat, of course. BMI is height overweight. So Arnold Schwarzenegger's height overweight in his height of his bodybuilding career, he would have been deemed obese. Clearly, when you saw him, he was not obese. However, the BMI still is a marker that is somewhat usable. I use in my office something called an InBody. We do body fat calibration. So you may have a 6'2", 200-pound man. I did that 200 pounds. In that 200 pounds, he may have 10% body fat. Somebody else could be 6'2", 200 pounds. It's not supposed to happen when you go Facebook Live. When you go, allergy cough. When you go, he could be 6'2", 200 pounds. In that 200 pounds, he could be 30% body fat. So again, obesity is more of a body fat percentage and a body fat ratio. It's not just height overweight. Thank you. I know, for obvious reasons, Mike, how are you? So having said all of that, let's talk about what it does and what it leads you down a path of. So can you give me the printout that I gave you about the obesity? I wanted to go through the numbers. So in any case, obesity for me is about 30% overweight. 30% body fat or more is what I should say. Some people like to call it 35%. I'm more in tune to about 30%. Most of America, I think it's 29 states out of the 50, it's right over here, 29 states out of the 50 are considered obese, and the other 21 states are heading towards obesity. They said they have projected that over, thank you, they have projected over 50% of, all 50 states will be obese by the year 2030. So that's a scary thought. And the doctors are realizing that under 65, I don't know where our older population is, and just so you know, older population over 65, it's hypertension. So now I've got the studies. It just came out in Medscape on April 16th. So the title of it was Obesity was linked to severe coronavirus, especially for what they deemed younger patients. And they were very surprised that those younger patients, young adults, were at risk because they were so heavy. So obesity is an important predictor of severe coronavirus illness. So lifestyle, 8 Weeks to Wellness, Dane Donahue, Veronica Hope, they got it right. What I do in my office, we have it right. It's all about lifestyle. So taking all these antibody tests right now, many people are coming back negative. Not everybody's been positive. Not everybody's been exposed. So people say, oh, great, now I don't have the natural antibodies. I'm happy I took the test. What do I do now? And I said, you get yourself as strong as you can. You get into the best condition you can. Since we're probably going to have this for a period of time, Harvard put out a study on the period of time. I don't even want to share it with you because it was a little disconcerting, and I'm a positive guy. But the bottom line is that I would much prefer people now go home and get into shape. Good diet, exercise, good sleep, good hydration, proper supplements. Hey Dave, how are you? It's great to see you, Dave D'Angelo. My man from Purity Coffee. Excellent. Great to see you. So getting back to obesity, interesting in that U.S. has one of the highest obesity rates in the world. People don't realize, I think we're like 28th out of the developed countries in the world. Our healthcare is horrible. Our emergency care is fabulous. Our first line responder doctors you're seeing now are fabulous, but people don't value their health enough. People don't value taking care of their body composition. They take it for granted, and that is now coming to roost, if you will. So my goal is for everybody now, really, let's have a discussion on how to get our body composition in a better number and improve it and decrease the fat on our bodies. So there's two types of fat. There's what we call that superficial fat. That superficial fat is you want to pinch an inch. That kind of goes away if you go outside and you run. But we have something else called visceral fat. Visceral fat is fat that is over our organs and can infiltrate our organs. That's a terrible kind of fat that damages our organs, and that leads us down a path of having more comorbidities. It can get over our heart, it can get over our liver, it can get over our kidneys, it can do all these different things. So the visceral fat is an issue. The visceral fat comes from a good quality diet over a duration of time. So visceral fat is something that you want to be pointed at. When we're all back in the office, anybody who's interested to have a great in-body, we can test your visceral fat, we can test your body fat. For now, let's get back, let's talk about good quality meals, intermittent fasting, time-restrictive eating. In addition to that, let's talk about exercise, good quality exercise, improper supplements. Now, the hypotheses why obesity was so bad was many people have compromised respiratory function prior to this infection. So they couldn't breathe, they were heavy. You know, people don't understand that fat cells, and everybody has a fat cell, the bigger your fat cell are, the more corpulent you look. Fat cells are depositories for toxins. So when you're toxic, you are inflamed. So the heavier you are, the more inflamed you are. The more inflamed you are, the closer you are to getting a cytokine storm easier. And we've all talked about that cytokine storm. That cytokine storm leads us down a path of having a lot of damage, detrimental to our overall health. So more abdominal obesity, which happens to be, believe it or not, the little beer gut, more prominent in men. This abdominal obesity, when you've got the gut, can cause compression of the diaphragm, lungs, and your chest cavity. Now, interesting, I was on a webinar yesterday, and we were talking about what we call nitric oxide. Now, nitric oxide is something that's critical to good quality health. When you have this obesity and in compression where you can't breathe, you don't produce enough nitric oxide. And nitric oxide goes down through many different health pathways. So your inability to breathe is also not all that healthy. You're not getting in enough oxygen. In addition, it talked about, piggybacking on what we just said, chronic low-grade inflammation is increased because increase in circulating pro-inflammatory cytokines. It's what we talked about before. When you're obese, it's a horrible comorbidity. And the problem with obesity is, think about some of the other comorbidities. CVD, obesity can cause CVD. Diabetes can definitely cause metabolic syndrome, prediabetes, and diabetes. Obesity, hypertension. So lifestyle, obesity could be the crux why you're having these comorbidities. And we all know that everybody, virtually everybody that's having a really bad detrimental outcome to COVID-19 is because they have one of these comorbidities. Everybody else goes anywhere from asymptomatic to somebody saying it's the worst flu I've ever had, but not having to go to the ICU or anything worse than that. So again, that source is Medscape, April 16th, 2020. So I had a few people reach out. Hey, Dan Drex, I am safe. I hope you are too. Let me give you a like for that one. Chris Carlson, long time no see. Not a better personal trainer that I know. Let me see if I can go back up and get this to work.
One of the better.
Oh, I had to say one of the better. Mike, toxic fat. Hey, Claudia, how are you? Mark Kendall, how you doing? Lauren, how are you? There's my guy, Dr. Lauren Marks, one of the best functional medicine docs located in New York City. Big shout out. We were having a great talk about methylation just the other night. One of those 12 o'clock in the evening talks. You would think that you would be doing something different, but that's kind of like what we do. I have to say, though, before we move on, I think I've done more reading and more conversing with smart people than ever before, and I'm usually in the office 4 days a week, and the next 3 I'm lecturing with other colleagues. This has been sort of an interesting time. Hey, Malia, how are you? It's great that you could join. So we talked about one of the more detrimental comorbidities. Now I'd like to talk about something that most people don't take notice of, but we're home. We're sitting a lot. A good friend of mine, Dr. Steve Weiniger, he was interviewed for Vogue magazine. He is a posture expert. Steve does a great job. Steve has a great phrase. He calls it not correct posture, but strong posture. So I have an issue. I have what we call congenital torticollis. So I will never be this straight atlas going like this. It makes no sense. People always try to straighten, overcompensate. And Steve was like, well, there's a structural problem. You got it at birth. That's why they call it congenital. Let's make it strong posture so you can hold your body in the position that is your posture. A little asymmetry to the left of the head, dropping the shoulder, etc., etc. Because not everybody's going to be able to put a book on top of the head and walk like we've always talked about. So we're all worried about strong posture and not breaks in posture that are right for your body. Trying to cover that, interesting that children, he made a great point in the article. He said he was at Disney. So Disney is, everybody running around. I haven't gone to Disney. You can't get good food at Disney, but it's insane. And he would look at the parents and he would say, the parents are in their 40s, little forward head posture, little round shouldered, not too bad, some easy work to be done. Then he'd see the children, 10, 11, 12, round shouldered, because what are they doing? They're playing on their phone. They're holding their phone. They're playing on the iPad. They're not doing eye-to-eye contact. We live in an interior head posture world. Everything's in front of us, so we become more round-shouldered. Our heads come forward. So as a chiropractor, we look at posture all the time. So it's very interesting that when you get your head posture forward, it shuts off a lot of your muscles in your jaw, and a lot of people get bruxism, but more so than that, they get mandibular pain or they get damage to the joint. So a lot of TMJ and TMD really comes from the positioning of this forward head posture. And a lot of people who take laser therapy, low-level laser like Aconia, soft tissue like active release, instrument-assisted, soft tissue adjustments, and exercise rehab can reposition your jaw and get a great resolve on your TMJ and your TMD. So, yep. Did I miss a question?
No question.
Oh, I got a bunch of shout-outs, so hold on. Let's go. Hey, Cassie, Mark, how you doing? Chris, all is well. Rita, hello. Dr. McGuire. Okay, great. We called him out. So with the forward head posture, that poses an issue in the round-shoulderedness. Really good articles on that. Again, Weiniger did a great job. A good friend of mine, Dr. Steve Weiniger. So if you suffer from something like that, why don't you send me your email, and we can link you with some exercises. The exercises is called the Brugger. Now, because of the camera, I can't stand up, but the Brugger requires a chin tuck, holding in your core, dropping your arms down, and extending your wrists. So I would recommend doing that for 20 seconds every 20 minutes. So there are things that you can do. And if you need some of these web exercises, sponsors, a whole bunch of stuff, we'll get you some exercises. And maybe what we'll do is we'll actually put a link in. I think we can put a link in, a link with a video on the Brugger so people could start doing the Brugger. Having covered that, it's very interesting. There was a statement that was in there. We call it text neck or text, text thumb. So a lot of people get the text neck and the text thumb. Everybody's sitting. Now, I'm sitting for these Facebook Lives, but I'm up and walking around. I'm a cheetah. There's no doubt about it. I move around. You can't keep me down. It's tough for me to sit, but people are sitting. It's really bad posture to sit. You're putting a lot of pressure on your lower back. Standing is less pressure than sitting on your lower back. Then also when you sit, for the most part, you disengage your gluteus maximus, the strongest muscle in your body, not per square inch. By sitting, shutting off your glute, you're also shortening your hip flexor. Your main hip flexor is your psoas muscle. Your psoas muscle anatomically goes from your belly button region, T12 to L5 not touching your L5 disc, going all the way to your thigh or your femur, touching what we call a bone called the lesser trochanter. So it's the only muscle that goes from your spine to your extremity, also touching your sacrum and your ilium. When that's shortened, that also neurologically shuts off your glute, and you get what we call anterior pelvic tilt. So your pelvis comes forward and you get an pain in your back, because when you get anterior pelvic tilt, you get pressure in your joints, or what we like to call as facets. In addition to that, shutting off your glutes, you're very common to have lower back pain. So people who fire their lower back before their glutes usually have lower back pain, and people complain about stiff weakness and stiff pain, back pain. What you're seeing is you're getting that from sitting too long. So the suggestion is get up and walk around. Adjust how you sit. Stay active. Sit on something. A great suggestion is take a couple of your books that you're reading, put them behind your spine so you have to press against them like I'm pressing against my arm. When you do that, you're going to have a better lumbar posture. I can feel it right now. And also, everybody, some of the things I always recommend in your exercise, do some exercises to facilitate your glutes. Do some exercises to stretch your hip flexors. We can incorporate some of those. You want to stand up and shift your position every few minutes at Brugger. Stand more than sit. Sit actively. Get your feet flat. Take a coffee break. And, of course, organic coffee, you know how I feel about that. So if anybody, Dave does a great job with organic coffee. I'd love to have some more. Hint, hint, direct hint. Throw it over the bow. Dave, we're waiting for it. Don't worry. We take packages. We take it all kind. If you could grind it first, even better. My wife went, yeah, grind it, Dave. You're on. Hey, Siriwan. Hey, Alex. Hey, Jessica Osborne. Yeah, we just mentioned you. We just mentioned, Jessica, a great choice for soft tissue release would definitely be the factor. And I use that in my office. And, Todd and Jessica Riddle do a great job. Big shout out to them. Hey, Kevin, pleasure that you could join. Haven't seen you in a while. Hope to see you soon. So again, let's do a little recap. I didn't see that many questions. I saw a new comment. But let's go see. Anybody asking questions? Let me know where you're from. Ask a question. Feel free. We will start posting some different things. Mitch, how are you? How you doing? Great to see that you could join us. I appreciate that. Again, so posture is a critical element. Sheridan once said, posture is the shadow of movement. So if you have these breaks in posture at home, your movement's going to break. And right now, you're not able to come see me. So with that break in posture, you're going to lead yourself down a path, a very detrimental path to your overall musculoskeletal health. Now, it's really funny. I was talking with a whole bunch of my colleagues, and hopefully I can get some feedback from you. Interesting. We'll get you the home address, Dave. I saw that. We'll DM that to you. Yeah, my wife went like that. She went like that. Good stuff. In the movement and the damage that we're talking about, the problem is, there's just, not that many chiros able to help you right now. They're not in the office. There's a shortage of protective equipment. So we've been doing a lot of telehealth and a lot of telemedicine. So if you're feeling those breaks or you need some help, let me know. We'll do a little video, Skype with you, and we'll send you some exercises. But remember, you're at home now. You shouldn't fall apart. Remember, we talked about obesity and posture. Two everyday things that we need to work on, meaning we got to watch what we eat. We got to watch what we drink. We've got to exercise. More so than just exercise, we've got to take good quality supplements. The healthier we are, the better chance we have of not having comorbidities. Like I said, you want to be an inhospitable host for all these pathogens, these bacteria, and these viruses. Posture also breaks in posture. This is very interesting. A break in posture also has a break in chemical inflammatory markers like chemokines and these interleukins. So movement is also the basis for biochemical breaks. Hey, Cami Paulson, any thoughts on kneeling chairs and standing desks? New to an office job and trying to adjust. Without question, I would love to show you, we have everything here standing. In my office, I have a standing desk. We have a standing desk right over there. So standing desks are great. I love the standing desk in my office, one, because I want to stand all day, and two, a lot of patients come in and see me that have lower back pain and they can't sit. right? Do you want to sit when you have lower back pain, or do you want to stand? So what is your body telling you? Standing is better than sitting. Laying down with lower back pain isn't good. You lay enough when you sleep. You spend a third of your life in bed. Hey, Veronica Hope, nice to see that you joined. How are you? We talked about you before. So everybody tell me, what kind of exercises you doing? What kind of stretches? What's your number one stretch that you're doing? I'm looking you to fill in. I know we have that little delay. I know Mike Powell loves it. His favorite stretch is to put on his robe and go in the sauna. So let me know how you're doing. And listen, every day I let you guys know it's getting worse, the hair. The hair is getting worse. So my wife is getting ready with the snippy scissors. We'll let you know. I think we're going to have to do this live on Facebook. I can't believe that this is going to happen. Let's see what we got. Mike says he loves Tai Chi. We got a comment. What do you like? Jill Williams, hey, how are you? You're new to us. Appreciate you checking in. Let me give you a like over there for that. Let me know what else you have. Tai Chi. Yeah, I mentioned the Tai Chi. Tell me what other exercise. Veronica, why don't you put in what exercises you do? Talking about exercises, talking about the posture. Interesting, there was another article yesterday, as you guys fill in, about asthma. So they originally said that asthma was a comorbidity of COVID-19. Only 5% of the fatalities came from asthma. So now they're saying it's so low, surprisingly enough, even though asthma is an issue with the lungs, asthma is now not listed as a comorbidity. With that being said, look at the difference in obesity versus asthma. And again, obesity is one of the main comorbidities. It's the biggest one from 65 or younger, and it can cause all these other comorbidities. Right now is the time to get home and, hey, Barry Scott, and start to get healthy. So as you guys know, every Monday through Friday, I'm here 1 to 1:30. We're having a great time. We're always talking about the issues at hand, strongly related around COVID-19 and how you can take care of yourself at home. If you have any questions, feel free to reach out. If you have any requests.
Rita just said that she works out every day, but she needs more strengthening. She loves kickboxing.
Rita says she works out every day. She does strengthening, but needs some strengthening. She does some kickboxing. Absolutely. Even, it's very funny. It's a great point that you brought up. If you go to the gym, which are closed now, but when they were open, you would see all the men in a free weight area. And you would see all the women on the cardio equipment. It's unbelievable. However, it almost should be inverted because one, cardio would be fine for men to incorporate. I think weight training does keep your body fat down without question. Muscle is very metabolic. But more so than that, the women need to get in the weight area because the women are so susceptible to osteoporosis, and the way to hold that off, to thwart it, if you will, is to do body weight or more exercises. So there's nothing wrong. Now, I do treat a lot of women, and I hear a lot of different things. Women said they don't want to get too muscular, too big. I reassure you, I walk on Fifth Avenue in Manhattan once a month, and I don't see too many excessively muscle-bound women. There are women that are in shape. There are women that you can tell lift weights, but I don't see a woman who's 220 pounds with 20-inch biceps. It's really rare. So you don't have to worry about it. I only wish I had that problem. My arms grew too big and I could put muscle on that easy with my body type at this stage of my life. So it's okay. Now remember, muscle takes up less space than fat. So the problem is sometimes people, not women, but people put on muscle but hold the fat, and it doesn't look quite as aesthetic. So if I had the model of fat and I had the model of muscle, you would see that muscle is 80% the size of fat. So if anything, if you get more muscular, you're going to get more trim and streamlined and hourglass shaped, if you will. Did we have a question? Because I saw you laughing.
Mike Powell said, I run to the squat rack. Does that count?
He runs to the squat rack. Does that count? That's a good one. Right now, you got to stay in the squat rack. People try to, to tie me up and keep me in the squat rack. I do squat, I do deadlift, I do the exercises that are needed. Hey, Lauren, how are you? Let's see what you got. Even obese people could jog in place, starting with a few minutes if tolerable. Yeah, absolutely. Great point. Why not? Everybody can do something. You don't necessarily have to go deadlift 600 pounds. Walking, moving, let's get going. So people ask, where's your starting point? That's a great line. Where is your starting point? It's baseline. Where is your baseline? So some people's baseline is elevated because they've been training for a period of time. My mom's almost 91. Our baseline is just to keep her moving. She's got some stiffness in the legs, some circulatory problems, just to keep her moving. That's a critical element. Just get them moving. So if there's any takeaways, please think about staying in shape, getting into better shape over the weekend, and the time that we're home, and the time that some things are changed as we morph into what we call this new norm. Be consistent with your posture. We'll put some links up. We'll get them from Web Exercise. Understand that breaks in posture lead to musculoskeletal injuries, lower back, shoulder injuries, jaw injuries, and the such. So people say, well, I didn't do anything when they have a musculoskeletal injury. And I usually snap a picture and say, is this normal for you? I will tell you one thing before we leave. I'll never forget, in 21 years of chiropractic, I will never forget this story. The gentleman came in, and this is his body, and he came in almost at this degree. He was about here. So I looked at him, I'm like, oh my God, this guy's in bad shape. Wow, I really got to pull some magic to help him out. And I said to him, how long have you been like that? He goes, like what? And I looked at him and I was like, really? And he's like what? And I said, look in the mirror. He goes, yeah, I guess I am bent over a little bit more. I thought maybe it was my mirror. It's been like a few months like that. He was literally totally hunched over, 40 years old too. And he just thought it would resolve on its own. He didn't realize how he looked. So take a look in the mirror. Look at yourself this way. Look at yourself in the side. Your ear's supposed to go through the middle of your shoulder. Turn around to the other side. See if your ear goes through the middle of the shoulder. And then take a picture while you look at your back. It should look like an S. It shouldn't look like a C. So if you're looking like a C, you've got poor posture and you've got a poor spinal curve, something to consider. Take a look when you stand. Are your toes pointed out? Are your hands in what they call this position, anatomical position? Are they like this? Are they like this? So if they're like this, you can see my shoulders one way. If they're like this, my shoulders in another position. So take a little quick look. Take a cursory look. If you want, DM me, take a picture of your posture. I'll take a look at that for you. It's not a problem. So just remember, posture and obesity don't sound like they're intertwined, but they really are, because breaks in posture lead for inflammation, which can lead you down a path of obesity. I got the tie in there. Remember, breaks in posture lead to inflammatory markers. Dane, what's up? My wife says I look in the mirror too much already. Yeah, man, you're in my club, but no one's worse than me. But I'm just making sure, and everything like that. But, we look in the mirror because we're rehearsing, because, Dane's an internationally known speaker and none better at providing and elucidating a clear message on health. So look him up, 8 Weeks to Wellness. He does a great job. Hey, Ty Hall, I'm happy you joined. Great to see you again. So again, if you guys have any questions, feel free. We'll add the links. I'm here every Monday to Friday from 1 o'clock to about 1:30. I got a lot of DMs before I came on. I really appreciate them all. Thank you for the encouragement. Sorry about we had a little Facebook problem. We didn't have all the little notes and everything. It's all good. It's all good. You got everything that you needed. In addition, tomorrow I'm super busy, and I'm very excited about it. I'm on with a bunch of my colleagues. I'm doing a 4-hour webinar from 9 to 1 o'clock for Nutridyne on the blood-brain axis. Really, it's technically called the gut-to-brain axis in health and disease, 7 steps to optimize the connection. So that's 9 to 1 Eastern time. And at 2 o'clock, I'm doing part 2 for Functional Medicine University. Big shout out, 2 o'clock for Immunity and Health. That's a free webinar. That's free. If you put your email in the bottom, I'll get you the free webinar. It's through Functional Medicine University. You have a great weekend, Mike Powell. Everybody have a great weekend. I'm going to enjoy myself. I'm having a great time. Thank you very much for taking time to check in with me. Dr. Rob, always yours in health.